Greetings, my name is Cameron-Maldonado, and I will be presenting our work on exploring gender differences in behavioral and psychological impacts of the COVID-19 pandemic among adults in Puerto Rico. Assessments of the Puerto Rico Community Engagement Alliance against COVID-19 Disparities. The COVID-19 pandemic has had a significant impact on the psychological health of individuals. The drastic changes in everyday lifestyle and resulting lockdowns led to dramatic changes in health behaviors. Many individuals have reported an increase in stress and weight during this time. A study survey conducted by the American Psychological Association reported that the stress levels in weight of Americans increased during the COVID-19 pandemic. The psychological and behavioral impacts due to the pandemic have varied by gender. Recent research has shown that women are more prone to have changes in emotional eating and stress under circumstances such as the COVID-19 pandemic. Nonetheless, pandemic changes in stress, weight, and eating snacking behaviors in Puerto Rico have remained largely unknown. Thus, we wanted to evaluate the changes in stress, weight, and eating snacking during the pandemic among adults and examine the differences by gender. This was a cross-sectional and secondary analysis of a survey conducted as part of the Puerto Rico Community Engagement Alliance initiative. For this, Rico-CEAL conducted an online survey that was carried on from December 2021 through February 2022. The survey was distributed through institutional newsletters, academic groups, social networks, and in person at selected supermarkets. Participants were those 18 years or older who resided in Puerto Rico. For descriptive statistics, we calculated frequencies, means, and standard deviations. To evaluate the bivariative association between gender and changes in stress, weight, and eating snacking frequency, we used chi-square tests. Lastly, we conducted multiple logistic and multinomial regression models adjusted for socioeconomic characteristics and obesity. Overall, our sample size consisted of 524 individuals with a mean age being 38 years. 73% were female, and 53% had some college education or were college graduates. Table 1 shows the association between gender and changes in stress, weight, and eating snacking frequency. Overall, 3/4 of the sample reported an increase in stress levels during the pandemic. 53 reported an increase in weight and 42.5 an increase in snacking eating. We found that a greater proportion of women compared to men reported increases in stress, as this was 78 for women and 64% for men. Similarly, a greater proportion of women compared to men reported increases in weight and in eating snacking frequency. Table 2 shows that for adjusting regression models, women versus men had twice the odds of reporting an increase in stress levels than no change in stress. In addition, we found that women were 55 more likely to report an increase in eating snacking over no change, and marginally, significantly more likely to report weight increases over no change. No significant associations were found between gender and decreases in weight or snacking eating. A substantial proportion of the sample reported increases in stress, weight, and eating snacking during the pandemic. And women were more disproportionately affected by these outcomes. I would like to thank the National Institute of Health, CEAL, and our funding source, which is the National Heart, Lung, and Blood Institute, and the support for the Hispanic Alliance. Thank you for your attention.